everyone, my name's Neale Fong. I'm the President of the Australasian College of Health Service Management. We just wanted to send a message to all of our members in particular, and in particular to those who are struggling and working really hard in Victoria. Victoria is our biggest branch with many fellows and many members, and our thoughts and prayers are with you as you work through the COVID-19 pandemic. Clearly in the eastern states, there are a number of issues, and many of our members, fellows, are leading the cause in terms of trying to bring this pandemic under some control. So our thoughts are with you, and as the board of the college, we just want to encourage you, wherever you might be in Australasia or overseas as our international members, that this is the time when the capabilities of us as healthcare leaders really need to come to the fore, that our communication skills, our encouragement skills, our relational skills to ensure that people are well cared for, that their mental well-being is managed well, is just so important. So that's why we invest in developing leaders and their skills. It's for times like this, and particularly in times of crisis and hurt for organisations and individuals. So our very best wishes to all of you, particularly our colleagues in Victoria. I want to bring you up to date just with some of the issues in our college and the value proposition in particular that we are hoping to maintain as a college throughout the year. As many of you would know, that we have now provided national webcasts free of charge to members. We have around about 20 of those that will be offered per year, and our branches are also organising professional development webinars and webcasts. I'm pleased to advise that our post-webcast surveys, 90% of those who attend these webinars believe that this is something they would recommend to their colleagues. So as part of the college, if you are a member, you can access these free, and this is a new way of learning, a new way of upskilling, and we encourage you to pick it up. In addition to the online learnings, as things do come back together, there will be times for events where we can come together, whether it be in small groups or large groups. And we will also ensure that there will be significant price savings for members of our college. So there's definitely an advantage of joining and being a member. We have also recently introduced a much reduced price for student members. And so I encourage students in health administration, health management, health leadership, health sciences, medical, nursing, allied health courses to actually look at our website and see where you can get involved as a student member of our college. Also want to bring your attention to two great resources provided by the National Office, our library bulletins. We have our standard library bulletin, which is very professionally put together by Ya Ping, and congratulations to her for providing such a plethora of resources from topics from Aboriginal health right the way through to health economics and everything in between. It's a précis that is provided free of charge to members. Ya Ping has also provided a library bulletin for COVID-19, specifically looking at areas in the health management of the pandemic, which is another added increase to the value proposition for our members. The college also provides the Asia Pacific Health Management Journal, which comes out 3 times a year on a digital edition. And we're very grateful for our partnership with SHAPE and the editorial team there led by Professor David Briggs, which brings for our members and other people a very good publication, academic and research papers. And we encourage our members to obviously read this and see that that's also a part of our value proposition of being a member. So the Asia Pacific Health Management Journal. I want to bring you up to date too on certification. As many of you would be aware, we have embarked on a certification program. If you are an associate fellow or fellow from the 1st of December this year, we'll be proceeding with designating you either as a certified health manager, if you are an associate fellow, or a certified health executive, if you are a fellow. And because of this extraordinary year, we are giving those people who get the certification an extra period of time to undertake the professional development hours that are required in the first year of the triennium. So that now is going to be pushed out by a further period of time. So that will be to June 30th, 2022. And so you'll have a full 18 months to actually earn the first 1/3 of the triennium required to maintain certification. It's really important that we have these requirements, because if we do have certified healthcare managers, certified healthcare executives, that does make a difference in job recruitment selection and career development, that we as a college maintain strictly that people are maintaining their learning and their growth as leaders. That's what the certification process is about. It's about ensuring that employers, and ourselves for that matter, know that we are continually updating and upskilling ourselves. Finally, the fellowship program. We look forward to many candidates sitting for the fellowship exam in October this year. It will be the first time that this will be done online. Our colleagues in Hong Kong have already been through this process, or about to go through this process. And so we look forward to their success in those examinations. We will also, for the first time, be having our annual general meeting by Zoom, and there'll be some small changes to the constitution that will be circulated to members soon for their consideration. So it's going to be incredibly impressive to see our candidates, 40 of them, sit for this examination. And we do thank Griffith University, who have assisted greatly in this process. And finally, can I just say thank you again to all of our staff, our national staff led by our Chief Executive, Catherine Chaffee, and the office there in Sydney, who are working under difficult circumstances, all our executive officers from around our branches, and of course our colleagues in Hong Kong and in New Zealand and in other international jurisdictions where we have individual members. I hope that you all stay well. I hope that you continue to provide great leadership as members and fellows of our college should, and that we can continue to encourage one another as we move through these times. Remember, our college, the Australasian College of Health Service Management, does really provide some great value to you in your role, in your task, and in your future development and your ongoing development as leaders in healthcare and community care. Thanks very much.